Dr. Aragol, a plastic and reconstructive surgeon for last 36 years. I've trained at Wayne State University in general surgery and plastic surgery, additional cosmetic surgery fellowship, followed by private practice in Metro Detroit area for over 30 years. Cosmetic rhinoplasty is shaping of the nose and desirable shape. The best rhinoplasty is the good-looking and anatomically correct, physiologically perfect rhinoplasty.
I was playing for Austrian national team rugby for many years, and well, this pretty much messed up my nose, and I had like broken bone 3 or almost 4 times.
So I'd taken a lot of trauma to my nose with different soccer balls or injuries from revolving from sports, and I had the buildup of the scar tissue from the fractures and the breaks that I had waited to have surgery done to correct it just because I was afraid of the healing time. And then eventually when I found the right doctor, I wish I would have done it sooner.
I also had very big problems breathing. I've never breathed on my both sides in my life, and this was my chance to fix the problem.
My past experience and prediction of the outcome is unique. In other words, the box stopped with me as far as rhinoplasty is concerned at this place.
I spoke to several doctors, and when I came here to Strax Rejuvenation, what I really liked, the doctor, he didn't ask me what would you like to do. He just took over. He said, oh, you need to do this to get like perfect.
Dr. Ham was my doctor. He's an amazing doctor. I had an amazing staff, and finally I decided this is the best thing for me.
This was 3 months ago. For the first week after I only had the splint on for a week and the stitches. So the stitches and the splint came off after a week, and almost all of the swelling was gone after a week.
And the recovery time was for me a couple of days. I had it done on Thursday, and then on Monday I was back to work. And I had no bruising. My biggest fear was the bruising, and I had no bruising at all.
It's not something that if you just walked up to me on the street you would know or tell the difference, because you can't tell, which is exactly what I wanted.
So when I came back for the post-op, she took the bandage out, the nurse took the bandage out, and she handed me the mirror to take a look at it because I was very nervous and I was very anxious to see the results. And for me it was like, okay, hold on, I have to breathe first. This is the first time in my life when I'm actually breathing on both sides. So then she handed me the mirror, and when I saw the results, I started crying. For me, it's such a big difference.